Hello, friends. This is Dr. Tom Graham, the Physician-in-Chief of the Lehigh Valley Orthopedic Institute, one of the nation's largest and most experienced practices providing care for the entire musculoskeletal system so you can keep moving. Our Orthopedic Institute is the region's leading center for orthopedic care and is the only practice recognized by U.S. News & World Report as one of the most elite providers in the entire country. That is why you should expect the highest quality, best outcomes, and an exceptional patient experience from the physicians who are the most experienced and expert in this field. The Lehigh Valley Orthopedic Institute performs twice the volume of sports medicine procedures and 3 times more joint replacements than any other health system in our region. More of our neighbors choose us to restore them to a comfortable and productive lifestyle, just as dozens of professional athletes from across the country rely on us to get them back in the game. When you're preparing for joint replacement, the cornerstone of your care is a trusting relationship between you and the surgical team. That is established through communication and sustained by relentless focus on your needs throughout the entire medical journey. To help you prepare and partner for the upcoming reconstructive procedure you will undergo, we have created a video which supplements your discussions with your doctor by providing general instructions and other important logistical information. You can review this in the comfort of your own home as you develop a game plan with your doctor and your family to maximize the comfort and success of your procedure. This video describes the tasks you'll complete before and during surgery, while highlighting the elements of the operation that will be performed by our skilled colleagues. Planning tools and tips on medications, diet, exercise are all included because these are aspects that will influence the overall experience and outcome of your procedure. Please take the time to review and understand this content. We want you to be an engaged partner in all aspects of a world-class orthopedic experience. If this brief educational tool stimulates some questions, get them ready and ask your caregivers. Be assured that our professionals are also preparing to participate in your care and assist you to achieve the goals you have set when comfort and mobility have been restored by this procedure.
This video references our total joint replacement surgical facilities and is intended to help you navigate your joint replacement journey both on and off our campuses.
If your healthcare provider has recommended total knee replacement, it may be because you have arthritis with severe pain and are unable to move freely, or medicines and lifestyle changes are not managing your knee pain. Let us start with a healthy knee. The knee joint is made up of the femur and tibia bones, with the patella or kneecap sitting in front. The bones are cushioned by cartilage, which enables smooth movement of the joint. Now that we know what a healthy knee is and how it works, let us look at an unhealthy knee. The synovial membrane is a unique lining in your knee that generates a fluid to aid in the movement of the knee. When this fluid dries up, it fails to provide cushion to your knee during movements, leading to joint damage and pain that can interfere with your daily activities and lifestyle. Let's look at a knee with a prosthesis. In a total knee replacement surgery, the joint is taken out and replaced by a new joint made from metal. This is called a prosthesis, artificial part, or implant.
Once your surgery is scheduled, your surgeon's office will arrange your necessary appointments to ensure you are prepared for your surgery. Your pre-admission testing may include a telephone call with a nurse and any necessary lab work, EKGs, or x-rays. Your primary medical doctor will also need to provide clearance for surgery, and any necessary specialty doctor appointments should be made as early as possible. You should check with your surgeon if they require a dental visit prior to your surgery. As we would recommend with any hospital stay, please consider making an advance directive indicating your healthcare wishes. This document will then be requested at the surgical check-in desk. Additionally, you will need to stop smoking and maintain a healthy weight by eating a balanced diet that includes fruits, vegetables, protein, whole grains, low-fat dairy, and an iron supplement and multivitamin. Use of illegal substances and alcohol abuse need to be eliminated as it would compromise the success of your surgery and your recovery. There are very specific instructions regarding stopping blood thinners prior to your surgery. You will need to discuss this with your primary care physician or the physician prescribing your blood thinners. Please review this list of blood thinners that will need to be stopped. This is a list of the most common blood thinners. If you have questions about medications that are not listed, please discuss with your surgeon.
Let us continue with general notes on what to do before your surgery. It's essential to arrange for someone to drive you home from the hospital when you are discharged. You should also arrange for someone to drive you to your outpatient physical therapy and follow-up appointments. Outpatient physical therapy is required after your surgery. And even if you require therapy in the home in the immediate days or weeks following your surgery, all roads lead to outpatient therapy. Also, be kind to yourself and make sure your home is ready for you after your hospital discharge. Here are some tips to help you. Put frequently used items such as coffee pots and kitchen utensils within reach and keep your home clean of pet fur and dander. You will not be able to clean up after your pets until the incision is fully healed. Arrange furniture that provides clear, safe walking paths. Remove throw rugs and rearrange electrical cords behind furniture to prevent tripping. Plan your meals in advance to make things easy. Complete minor household repairs and chores. Make sure there is clean bedding for when you get home. Don't forget to pack your bag for the hospital. Bring personal hygiene items such as toothbrush, deodorant, loose-fitting clothes such as sweatpants or shorts, t-shirts, and rubber-soled shoes with a back, such as a sneaker that you can slip on and off for day wear. Please remember, no sandals or flip-flops. Your surgeon's office will let you know if you need to bring any assistive devices, such as a rolling walker, a cane, or crutches. Be sure to label these items with your name. You may also consider bringing your favorite book or crossword puzzle with you, but avoid bringing valuables such as jewelry or large amounts of money. Leave these items at home. Lastly, you may bring your cell phone, laptop, iPad, and chargers. Free Wi-Fi is available at all of our hospital locations.
Please also ensure you are following instructions regarding any preoperative skin cleansing that has been provided to you from your surgeon's office. Some patients also require a nasal ointment. You will receive a call from nursing staff on the evening prior to your surgery. If you are having surgery on a Monday, you will receive a call on the Friday before. During this call, you will be provided with what time you should come for your surgery. You will also receive instructions from the nurse regarding when you should stop eating and drinking. Instructions regarding clear liquids will be given to you. These instructions may change depending on your surgeon and your time for surgery. Clear liquids include black coffee, water, and apple juice. Clear liquids do not include milk, creamer, or orange juice. Please do not shave any body part within 24 hours of surgery. If you develop severe cough, flu, or COVID-19-like symptoms, fever, or an infection in the days before your procedure, please call your surgeon. Please refer to the visitation and masking policies at your surgery location. These policies may change with the season and with trends in contagious illnesses. An adult must be ready to drive you to and from your surgery. Please note that a parent and/or guardian of a minor under 18 years old must stay in the building the entire time the minor is present. An adult must stay with you at home for 24 hours after surgery. Please do not bring children to the hospital unless there is another adult with you who will take care of them during your surgery.
When you arrive at the hospital, you will check in at the registration desk. Please be ready to provide a valid photo ID such as a driver's license. Provide your insurance card and give basic personal information. Give any health insurance information. Sign consent forms for billing and care in the hospital. You will receive an identification or an ID bracelet. This ID bracelet is for your safety and should be worn until you go home. Preparing for surgery can be a nerve-wracking experience, but being informed and knowing what to expect can help ease some of those anxieties. Remember to bring any eyeglasses, hearing aids, dentures with cases or holders, and/or all other items you have been asked to bring with you. When you arrive at the hospital, at your scheduled time, there are a few things you can expect to happen before you are taken into the operating room. Your family or friend will stay with you in the waiting area until a nurse comes to take you back to a patient room and asks you to wash your skin with antibacterial wipes. When complete, Your family or friend may be with you until you go into surgery.
Next, you will receive an intravenous line to give you fluids and medicine, and your vital signs will be checked. Your surgeon will then come in to examine and mark the area where the surgery will take place with a black pen that is not permanent and can be washed off with soap and water after surgery. Next, an anesthesiologist will work with your surgeon to determine which type of anesthesia will work best for you based on your medical history and current health conditions. This will be discussed with you prior to surgery. Anesthesia is a medicine that usually blocks both pain and other sensations, including muscle movement, during surgery. There are a few types of anesthesia that can be used for total joint replacement surgery. These types of anesthesia are spinal. A medicine is injected into the fluid in your spine. The medicine works well for short and simple procedures. Nerve block. A medicine is injected into the area of a certain nerve or a group of nerves to block pain. General anesthesia. Medications that put you in a sleep-like state during your procedure. This may require the need of a breathing tube to help you breathe during surgery. For a knee replacement, spinal or general anesthesia may be used. Upon arrival to the OR, your nurse will introduce the operating room staff. Staff will begin positioning you on the operating room table. After ensuring you are comfortable, the anesthesiologist will administer your anesthesia. You will be monitored throughout the entire procedure for both comfort and safety. Once the surgeon and surgical teams are finished with your surgery, you will then proceed to the post-anesthesia care unit. Once you leave for surgery, your family or friend may wait in the designated waiting area. If your family or friends plan on leaving the hospital, please give their phone number to your nurse. Lehigh Valley Health Network has free wireless internet for visitors. LVHN also offers the EASE app to give your family or friends secure status updates during the surgery. You must sign a consent form and decide who can receive the updates prior to surgery. Please ask your nurse for help setting up the app. The Post-Anesthesia Care Unit, or PACU, is the nursing unit where you will go to recover from anesthesia after surgery. The length of time you will stay in the PACU will depend on the type of surgery you had, as well as the anesthesia you had. Your nurse will monitor your blood pressure, heart rate, and breathing after your surgery. They will also ask you if you have any pain and administer a pain medicine if needed. It is common at this time for the nurse to ask you to take deep breaths, cough, or move your feet and ankles. You will continue to get IV fluids until you are able to drink clear liquids without having nausea. Your surgeon may order IV antibiotics for 24 hours after surgery. You will be discharged from the PACU when you are stable. You will then be moved to a hospital room if you're staying overnight for observation, or you will be discharged to go home.
If you are staying in the hospital following your joint replacement, the expected length of stay is 1 overnight. Additional days may be necessary based on your progress with physical therapy and medical necessity. No stay is typically longer than 3 days, and the care team will discuss all discharge plans with you. Case management will keep you informed regarding your anticipated discharge needs.
You will be allowed to drink clear liquids as instructed by a nurse and will gradually start eating solid foods once clear liquids have been taken without any nausea or vomiting. If you need help with food service during your stay, you may speak with a registered dietitian or dietary staff member. A menu will be in your room, or a dietary staff member will come to discuss food options and take your order. At some locations, a number will be provided for you to call to order your meals. Constipation or difficulty passing stool can happen after having surgery because you are not as active as usual and are taking pain medicine. You may need a special bowel medicine such as a laxative, suppository, or enema to help you have a bowel movement. If you have constipation, you can take a stool softener or laxative. You should drink at least 8 cups of water or juice every day unless you are on a fluid-restrictive diet. Be sure to eat fruits, vegetables, and whole grains.
A catheter is a small tube that will be placed in your bladder and connected to a container to collect urine. It may be inserted while you are under anesthesia to help the surgeon monitor your kidney function. The catheter will be removed by the morning after the surgery. During the healing process of your incision, a protective bandage and dressing will be applied over it. Your incision may be closed with staples or glue depending on what your surgeon deems appropriate. Before you are discharged from the hospital, you will be instructed on how to properly care for your incision. after surgery, swelling and bleeding can be reduced by applying ice. Your surgeon will prescribe ice packs to be placed on your dressing, and when they become warm, your nurse can provide you with a new cold ice pack. You will receive ice packs and a protective cover to take home with you. Post-anesthesia, it is common to experience pain, but the medical team will try to manage it effectively. You should inform the nurse immediately if you start to feel pain without waiting for it to become severe. Pain can be rated using a scale of 0 to 10 by referencing the Wong-Baker FACES pain rating scale seen here. Pain medication is available in different forms, including orally, by injection, or through an IV. There are potential side effects of pain medications such as constipation, itching, nausea, and drowsiness. To alleviate pain, you can put ice on your incision, elevate your leg, change positions frequently, and engage in relaxation activities such as listening to music, watching TV, or reading.
After undergoing total joint replacement surgery, preventing the occurrence of blood clots or deep vein thrombosis, also known as DVT, is crucial. To achieve this, blood-thinning medicines or anticoagulants will be administered. Your surgeon will determine the type of blood-thinning medication to prescribe, which may be in the form of an injection or oral tablet. Typically, you will be required to continue taking the medication for around 1 month after discharge. In the case you are prescribed warfarin, Coumadin, upon discharge, your healthcare provider will schedule a blood test known as PT-INR to ensure that you are taking the correct dose of medicine. It is crucial to strictly adhere to the medication instructions, as certain foods will have to be avoided and there are other associated risks. To help prevent blood clots in the legs after surgery, a sequential compression device, SCD, will be used. The device includes a pump and an inflatable wrap that is placed around your leg or foot. By gently squeezing your leg muscles, the SCD acts as a natural way of moving blood back to your heart, similar to walking. You will be required to wear the SCD while in bed and when sitting in your chair. The medical team will ask you to cough and take deep breaths following your surgery to prevent pneumonia, which is a severe lung infection. To help you breathe deeply, you will be provided with an incentive spirometer. It is recommended that you take 10 deep breaths every hour while awake for several days after the operation. A member of the nursing team will provide guidance on using the incentive spirometer. After completing the breathing exercises, try to cough. During the recovery period after surgery, you may receive oxygen through a nasal cannula, a small tube that rests under your nose. To monitor the oxygen levels in your blood, a device called an oximeter may be attached to your finger. This is a common practice during your recovery.
On the day of your surgery, a physical therapist will assess you. Their main objective is to assist you in getting out of bed and standing on the floor. The ultimate aim is to help you sit comfortably in a chair placed bedside. If you're doing well, the therapist will also help you take a few steps to begin walking. Our nursing staff may also provide aid in getting out of bed. Occupational therapy will see you after your surgery, if necessary. Their focus will be on activities like getting in and out of bed, using the bathroom, and self-care like bathing and dressing. OT will ensure that you can perform these activities independently while you are at home. It is recommended that your caregivers be present during your final therapy session before your discharge. During your hospital stay, PT will instruct you on an exercise regimen that will consist of exercises you can do independently, as well as exercises that may require assistance. Our goal is for you to perform these exercises several times throughout the day. Some exercises may require assistance and can be performed while in bed, sitting in a chair, or standing up. After you are discharged, you will need to continue doing your exercises at home 2 to 3 times per day. The physical therapy department has a range of equipment available for you to use during your hospital stay. Immediately after your surgery, you will most likely require a rolling walker, which is equipped with wheels. Your therapist will inspect any personal equipment you bring with you to the hospital to ensure that it is safe and fits you correctly. If you have custom equipment, such as a brace or special footwear, please remember to bring it with you and label it with your name. There are several pieces of equipment that can assist with self-care activities, such as using a long-handled shoehorn, dressing sticks, sock aids, and reachers. If you and your occupational therapist believe that any of these would be beneficial to you, your case manager will arrange for their delivery to your home before you are discharged. You may also require a shower bench, raised toilet seat, walker, crutches, or a cane, which your case manager will order as necessary. Prior to discharge, your therapist will work with you to develop a personalized treatment plan to ensure your safety when you leave the hospital. This plan will include getting in and out of bed, walking to the bathroom, walking in the hallways, climbing stairs if applicable, and performing self-care tasks such as bathing, dressing, and using the toilet. During your last therapy session, we encourage your family or caregivers to join us to understand your discharge plan and ensure your readiness to leave the hospital as scheduled. Your last therapy session is scheduled for the morning of your discharge day. However, if you are unable to complete all of your therapy requirements, a second therapy session may be necessary on your day of discharge.
After your surgery, it's important to continue your therapy exercises to help you regain your strength and mobility. There are a few options to continue your therapy after you leave the hospital. If you are discharged home, you will be ready to continue your physical therapy exercises in your home, as well as attend outpatient physical therapy. Should you not be able to attend outpatient physical therapy following your discharge, there are a few options we will explore to ensure you continue your physical therapy. One option is home-based outpatient physical therapy, where a physical therapist will come to your home for 3 to 6 visits before you move to a physical therapy outpatient office. Another option is home health care, which involves referrals to home health agencies for physical therapy and other services in your home for 3 to 6 weeks before moving to an outpatient physical therapy office. In some cases, patients may require a short stay in a rehab or skilled nursing facility. Your case manager will work with you and your insurance company to find a facility that will be covered by your insurance plan. You can either be driven by a wheelchair van, which may cost money, or a family member or a friend.
A successful recovery is our goal for every patient, from your initial appointment with a surgeon, throughout your hospital stay, and through your recovery following your discharge from the hospital. Every individual on your care team is focused on providing you the education and resources needed to ensure that your mobility is restored. Now let's look at some of the most common topics as you transition from the hospital setting. When it comes to showering after your surgery, there are a few things to keep in mind. First, if you still have staples in your incision, you can shower as long as you don't have any drainage from the incision for at least 24 hours. Second, you should not take tub baths or soak in pools, hot tubs, or spas for 6 weeks unless otherwise instructed by your surgeon. And finally, regardless of whether you have staples or not, it's important to keep the incision clean and dry and to avoid using creams, lotions, or powders on it. If you have any concerns or issues, be sure to contact your surgeon's office for guidance. Make sure to take all your medications as directed by your healthcare provider. Prior to your discharge from the hospital, your provider will review your medications with you. You may receive a prescription for injectable medication to prevent blood clots, which you or a family member or friend should be trained to administer before leaving the hospital. Your home care provider can also offer instruction on giving these injections. Always consult with your healthcare providers before taking any over-the-counter medications or supplements, including herbal and vitamin products. To reduce swelling, some surgeons recommend you wear elastic stockings for 4 to 5 weeks following your surgery. By referring to the symptom chart shown here, you can identify if your symptoms require you to take action. If you experience the symptoms listed in red, you should call 911 or seek emergency care. In addition to the information provided in this video, the orthopedic nurse triage team is available to you via phone call in the days and weeks following your surgery. This nursing team provides support and care coordination to make your transfer to home go as smooth as possible. The contact information for this team will be provided to you upon discharge from the hospital. Our team looks forward to supporting you in your post-op recovery.
Some additional questions you may have include: when can I take a shower and get my incision wet? If used, the bio-occlusive dressing, a clear, see-through dressing, allows you to shower immediately. Otherwise, follow discharge instructions. Should I change my bandages? Nursing staff will provide specific instructions on discharge. When will my staples be removed? 10 to 14 days after surgery at your post-operative visit or at physical therapy. Can I get another prescription? Prescription refill requests are under the discretion of your surgeon. Controlled substance prescriptions also require the review of the Prescription Drug Monitoring Program through the State Department of Health. These requests must be provided 48 hours for review. When should I request a pain medication refill? Do not wait until you are out of medication. Call when you have 2 days of medication left. Ask for pain medication refills Monday through Friday during business hours. If you expect to run out of pain medication over the weekend or on a holiday, please call in advance. Will I set off the metal detector at the airport? Your new joint may possibly activate a metal detector. At the airport, be sure to notify TSA about your joint replacement. We anticipate that you will return to your normal activities in about 6 to 8 weeks. For all future doctor's visits or if you are having other surgeries, be sure to tell your healthcare provider that you have a joint implant. We hope the information provided to you through this video will help to enhance your knowledge and the experience provided at Lehigh Valley Health Network.
In closing, thank you for choosing Lehigh Valley Orthopedic Institute as your partner in caring. We're honored that we've earned your trust, and we're prepared to serve you in any way with the level of expertise of a national leader that is right here in your own community. Good luck and thanks.